Now let's get to the next edition of our coronavirus vaccine special Q&A series, Shot in the Arm, where we take your questions from our Facebook live stream right now and get them answered by two area health experts. Thank you for starting your morning with us and being a part of this important conversation. I'm Mike Kirchhoff.
And I'm Megan Reisted. Joining us for this hour-long special, we have Dr. Matt Anderson, the Senior Medical Director of Primary Care at UW Health, and Dr. Jorge Ramayo practices internal medicine and pediatrics at the 16th Street Community Health Centers. Good morning to you both. Thank you for being here. And first of all, we are right now in phase 1B of the vaccine rollout in Wisconsin. Let's go through what that means and who can currently get the vaccine.
Yeah, I can take a crack at that. So starting off with our previous 1A patients or individuals are certainly eligible. And then you have your 65 plus, educators in childcare, long-term care, Medicaid programs, non-frontline healthcare workers, congregate living individuals, and essential workers in a number of different employment opportunities.
Dr. Ramayo, the next phase, phase 1C, that's expected to be announced soon, possibly later on this week. Details aren't completely final yet, but we've heard a little bit about it. Who do you expect to be in that group?
I think that it was not very helpful to speculate too much because things can change at any minute. I am very hopeful that the people with pre-existing conditions such as obesity, diabetes, high blood pressure will be prioritized in this group, so we can definitely get them vaccinated ASAP since they are such a high risk.
Now, we have a viewer named Scott who asks, he says, why teachers are being vaccinated, but I keep hearing from the government and media that seniors have first priority. Both of my parents, both in their 80s, have called repeatedly without being given an appointment to receive one. Can you speak to this and also talk about what is the best way for people who are eligible to go about getting their vaccine?
Yeah, it can be a challenge when there are parallel groups, and we know that the 65 plus were eligible first, and then you have the teachers and educators became eligible on March 1st. So we know that we're not done vaccinating 65 plus, and so there can be some challenges there. I think the best news, best recommendation is to go to the DHS vaccinator map or talk to the local health system the person receives care from and be looking for where is vaccine being distributed and administered by, and then hopefully that individual will be able to get a vaccine as quickly as possible. The state did allocate the Johnson & Johnson dosing that they got for the educators. So really those two groups right now are being vaccinated in parallel, with 65 plus having had a bit of a head start.
So why was the decision made to do it like that, not to do all of the 65 and older and then go to teachers, or not to like finish 100% of one group and then move to the next one?
It'd be a good question for DHS. I think that their stated goal was to make sure that there was enough demand so that all the vaccine is being used. I think there's also obviously a strong impetus from the federal government and from others here locally to get teachers back in schools, and vaccination is part of people feeling more comfortable with that. So I think it's probably those two main factors.
And when it comes to timeline, what are you expecting for the rest of the phases? What have the two of you been hearing so far?
Can you clarify what you mean by timeline? You mean when the next phase would be?
Well, we've heard from President Biden that he is expecting by May there will be enough doses. Not necessarily everyone will have a vaccine by May, but he is expecting there to be enough doses available for everyone in the U.S. at that point. Have you heard anything in addition to this as far as who could be vaccinated, as we roll out that timeline as that continues?
I feel that we had some predictions initially after the inauguration, and then with the addition of the Johnson & Johnson vaccine, those have escalated quite quickly. I can give you from a community health center standpoint, we have been escalating our vaccination efforts tremendously, and we've been able to really expand the number of vaccines we're giving. So my hope is that most of the patients that qualify will be able to get it by the end of May. In terms of more specific steps that they're taking to expand the vaccine, I think maybe Dr. Anderson may have a little more insight, but I'm not really sure.
Okay. Dr. Anderson, we do have a viewer question just came in from Renee. She says, if I get the Moderna vaccine at one location, do I have to return to the same place for the second, or can I go somewhere else as long as I get the same vaccine and it is within the time frame recommended? I will have my card to prove vaccine. So she gets that Walgreens, and then could she go to a community health center to get the second one?
it really is recommended and important that people get the second dose at the same location they got the first dose. That's really because of the way that allocation occurs. And so the state and the federal government are trying to make sure that everybody has access to that second dose. So 3 weeks, or in the case of Moderna, 4 weeks after she receives that first dose at, say, Walgreens is going to get that second dose and have that, there and available for her. So, there could be rare extenuating circumstances where that's not possible, but in general, it's important to make sure you get it at the same location both times.
Thank you both for this information. This will continue all morning long here on WMLW until 8 a.m. So be sure to stick with us. Still to come, what will life look like after getting the vaccine? We are asking the questions about life getting back to normal. That's next.
All right, we are back here in the commercial break. So those of you watching on air can't see us right now, so I don't know why I'm talking to you. But people watching on Facebook Live, thank you for continuing to watch right now. We just had a great question from Renee Burns. And doctors, we had a question that was sent in overnight, and we'll try our best to answer as many of these as possible. Here is what Chuck Marshall said. I'm going to read this to you word for word. It says, I wish someone in the media would stop playing games with this and get the truth about the vaccines and other issues with COVID. Do they work against the new strains? So doctors, Dr. Ramayo, why don't you start? Do these vaccinations work against the new strains we're hearing about?
Absolutely. I feel that sometimes it can be frustrating for people to hear different things and different messages. And the reality is that these new strains are fairly new. It takes time to study them in detail and give very decisive answers to say, yes, no, this is exactly what's going on, because we still don't know a lot of details. But what we do know is that the vaccines, both Moderna and Pfizer and the Johnson & Johnson, even though may not necessarily be 100% effective at preventing an infection, do reduce the number of cases that are severe enough that require hospitalization. So we do know that there's a benefit. Now, in terms of giving exact numbers and figures, that's going to come with time. And I think that's something that people need to realize, is that this is an ever-changing story. There are different people that are trying to get down to the answers, but the figures and the numbers continue to change based on the number of cases we have. So the preliminary studies and the preliminary data does show that this is actually effective against a lot of these new variants that are coming up, and it's still worthwhile vaccinating yourself.
Got just about a minute left in the break here. Chuck's next question was, where are those strains right now, specifically, let's say in Wisconsin, Dr. Anderson?
Yeah, when you think about the UK variant, the B117, there's been some small volume there. Obviously, we're not sequencing large volumes or particularly large volumes at this point. So we've been fortunate that we haven't had a lot of other variant activity that we've at least identified. They may be here, but I think the things you look at really at this point that really align with what Jorge's saying is, that protection. Yeah. Case counts have been doing well, and our hospitalizations have been doing really well lately.
We'll keep that going here when we come back from the commercial break in just a moment. Thank you, doctors.
Welcome back to our coronavirus vaccine special. We're taking questions from our Facebook live stream and getting answers for you.
Dr. Matt Anderson and Dr. Jorge Ramayo back with us once again. And there's still a lot we don't know about what life will exactly look like after vaccination. The head of the CDC basically admitted that when the agency announced new guidelines this week.
We're hopeful that our next set of guidance will have more science around what vaccinated people can do. It's important to note that this is initial guidance. The science of COVID-19 is complex, and our understanding of the virus continues to rapidly evolve.
All right, so Dr. Ramayo, what do we know so far about visiting people, and what are these new rules after you do get fully vaccinated?
Absolutely. So there were new rules and guidance that was actually released earlier this week, in which people that are fully vaccinated, and fully vaccinated means 2 weeks after your final dose, are able to meet with small groups of people indoors, as long as everybody's vaccinated without masks. This is brand new guidelines. The other one is that you can actually meet with small groups of people, people that are vaccinated with people that are unvaccinated, as long as the other people are low risk of actually contracting that. But in terms of like being out in public, like restaurants or other places, masks are still very highly recommended in general.
Okay, and when it comes to travel, what are your thoughts on getting on an airplane once you're vaccinated?
I think the biggest piece there is what Jorge was just mentioning, which is in public, we need to continue to follow all of the same protective guidelines that we have been. That's partly for your protection, but more so for the protection of others around you who may not be vaccinated. So travel is one of those difficult things. I think you can feel pretty comfortable from a fully vaccinated individual standpoint that you're probably lower risk for severe complications, but still need to take all those usual precautions to help protect other people around you.
So, well, why, the question is asked, well, why are you saying that? You know, if I've got the vaccination, I'm invincible, right? I can't pass it to anybody else. Why do I have to worry about anything?
Well, we don't know that. That's the answer to that, is that you may be at less risk of actually contracting the disease or getting serious complications, but we don't know whether you actually are able to carry the disease with you and actually be able to give it to other people. So that's still a question that's being studied, but for now, we don't know if somebody that's vaccinated is still unable to give it to other people, and that's what we're trying to protect, those that are unvaccinated as well.
Now, we've heard new guidance from the CDC on people who are fully vaccinated getting together. You just covered that, but let's say I'm the only person who has not been vaccinated and I want to get together with a small group of other people who've all been vaccinated. Should I feel comfortable or not?
I think each individual has to take their own risk assessment with that. Obviously, if you're a low risk individual getting together with fully vaccinated individuals, the CDC is saying that distancing and masking are not necessarily required, but try to keep that to, you as an individual and not meeting with other unvaccinated people who are from a different household. So when that happens, CDC is saying still wear your mask, keep your distancing in place. So the situation you described of one unvaccinated individual who's low risk with a small group of fully vaccinated individuals, they are saying that that's, reasonably safe for people's different risk tolerance.
So many people just became eligible in the last 10 days, and so a lot of people getting those first shots right now. What about in between the two shots if you're not getting the Johnson & Johnson vaccine? Can you do anything different? Can you expect any more protection after the first shot?
You can expect some protection after the first shot, but it's not perfect. It's not anywhere near the 94-95% that we see with the other vaccines. So this guidance is specifically for people that have received the entire dose schedule, so either 2 doses or the 1 dose for the Johnson & Johnson, and waiting 2 weeks after that final dose. So you do have some protection after the initial one, but it's not perfect.
Okay, and let's say someone is fully vaccinated and they have exposure to coronavirus. Do they need to quarantine?
So CDC came out and said as long as you are asymptomatic and fully vaccinated, you do not. But if you develop symptoms, you absolutely need to quarantine and arrange for testing with that.
So many hypotheticals, but these are all the questions people are asking right now. What if this, what if that, what if this? Because we just don't know, and we're trying to get those answers for you this morning. We have to take a quick break, but keep sending in those questions over our Facebook live stream. Again, just go to the CBS 58 Facebook page and get those questions coming in. The CBS 58 Coronavirus Vaccine Question and Answer Special, Shot in the Arm, continues ahead. All right, we're back on Facebook Live, everyone. Thank you so much for continuing with us. We're going to ask some more questions. Megan?
So here's one question that just came in from Thomas on our Facebook live stream. He said, what happens if one loses their vaccine card proof? Everyone has been saying, make sure you bring that card back with you when you go the second time to get your shot. But what happens if you lose it?
The Wisconsin Immunization Registry has all the documentation. We as vaccinators are required to put that information in. So talking to the vaccinator, about that, we should be able to have that documentation and provide the updated information for them.
Okay. One other question that I have that another viewer put on my Facebook timeline when I posted this initially, saying, please let us know your questions, is she was curious about fertility and if any of the vaccines have any effect on that.
So far, there is no evidence whatsoever to say that fertility is affected by any of the vaccines. That is a rumor that's based on false information. So that is not the case.
Okay. Dr. Anderson, did you want to add anything to that, or is that?
No, I agree completely.
Okay. Yeah. How about any other myths that you guys hear? Are there any others that you hear often that you feel, that you want to clear the information about?
I think there's misinformation out there about a lot of things related to vaccines in general. With this one, that it alters your DNA, which is not the case. The mRNA vaccines do not do that. And really, I think the key message overall is these vaccines are proving to be very safe, and we've had millions and millions of doses, and people are doing really well with them with low rates of anaphylaxis. And we need to obviously continue to study them, but I think people should feel very comfortable and confident with the safety profiles that we're seeing right now.
Yeah, that's a good point. So many people have gotten it right now. I mean, it's something like 10% of the country has had at least one dose, and so maybe before, a month ago, 2 months ago, we didn't know, and now you're kind of knowing, right?
Mm-hmm.
Yeah, absolutely. I think that, again, and the CDC came out and published a couple of weeks ago some interim data. So the more data we get, what's been seen in the trials is really proving to be true in reality outside of the trials as well. So again, I think people should have a lot of confidence in this. I think you're starting to see that in the public with some of the public opinion polls as well. So I think hopefully people are seeing that and will be responding, getting vaccinated.
Okay, thank you both. We'll be right back with you in just a minute. Welcome back. Our coronavirus vaccine special, Shot in the Arm, continues this morning. We are taking questions from you right now on our Facebook live stream. We want to hear those questions. And looking at one right now, one woman wrote, COVID vaccines are overwhelmingly enough. But today my coworker is 51 and she got an appointment at the Walmart in Franklin. And don't get me wrong, I'm happy for her. But why? How? My husband is 61, he has asthma, and he keeps checking his eligibility, and it says group 3, not now. So how do you guys, let's talk about how are those categories justified, and what happens when someone who maybe someone feels like shouldn't be eligible gets it? Should we be happy for them? Should we not be?
There's this phenomenon of vaccine envy sometimes, especially that happened at the very beginning when only a few people were actually eligible for it. And at the end of the day, everybody was finally able to get it. I feel that there's a very fine balance that is trying to be struck between trying to keep as many people as healthy as possible, trying to prevent the spread of disease, but at the same time trying to prioritize the groups that are at highest risk. And that can actually be shown when we started vaccinating people that live in retirement homes, for instance, where we were seeing the highest levels of death. So I feel that no rule or no category is going to be completely perfect. The experts and the panels that are making these decisions at the state and federal levels are doing the best they can to provide some guidance for the state to make sure this is an equitable distribution of the vaccine. And the only thing we can do for now is just continue to hope that we get more and more, so that we can have people like the caller's husband to be able to qualify as soon as possible, be able to get a vaccine appointment soon.
You mentioned vaccine envy, but what about vaccine guilt? I've heard from a lot of people that think that while they are eligible, they don't deserve it in front of their neighbor or something, and they feel guilty taking that vaccine. What do you have to say to those people? Both of you, I'd like to hear your response on that. Dr. Anderson, you first.
I think that we see that, hear that from individuals. And I think that one of the pieces that I would say to those people about that is, by you being vaccinated when you're eligible, you're utilizing the vaccine and you're contributing towards that march towards herd immunity. So you're actually then taking those steps to protect other people in your community. And so, Jorge's absolutely right. There's no perfect system here. People are doing the best they can. I think the key thing that I would say there is get vaccinated when you're eligible. And that is contributing to protection of everybody, in addition to continuing to mask and distance when you're in those public spaces like the CDC is recommending.
When it comes to public perception, where would you say we're at right now? It almost seemed like when we were first talking about the vaccine coming out, people were not so sure about it. There was a lot of distrust, but it seems as though now more and more people are taking it and they're okay. People seem to be a little bit more, they're less reluctant to take it. What do you think? What are you hearing from your patients and from people in your communities?
Initially, there was definitely a lot of hesitancy from a lot of patients, even though they were eligible. And I was frankly surprised. I think being able to relate your own story about when you got vaccinated, what happened to you, and being able to tell them firsthand, this is what happened and this is why I recommend it, has been very powerful. And now that more and more people are actually getting vaccinated and they're seeing that in their social media posts, they're seeing that in their status updates and things like that, it's really allowing people to see that this vaccine is safe. And that's because they know somebody that got the vaccine and they did okay. So I think that's really helping change some people's minds, is just knowing someone that got vaccinated.
We've got Tom, who had 2 questions on our Facebook live stream. Again, thank you for all these questions that are coming in. He said he has 2. He said, I know with the flu shot, it takes time to become effective. Just got my first Moderna shot. How long before it becomes effective? Care to answer that one real quick?
Yeah, it's about 2 weeks after that second dose, the CDC saying considering full vaccination. So continue taking those precautions, but considered fully vaccinated 2 weeks after that second one.
Okay, and we've been talking about the timeline a lot, but he has a very specific question right here. He says, I know right now the vaccine is for over 18. What is the timeline for under 18? He has a relative who is 14 with asthma. So a child with pre-existing condition, when can we expect those, even just say middle to high school age students?
So, one of the vaccines is actually for 16 and over. So that's one of the things that we have to really clarify. And those numbers are based simply on the age cutoffs that these companies use to study the vaccine. In general, we try to be very careful with doing any clinical trials on the pediatric population. So we want to be very careful with the kids, make sure that it's safe and it's not going to harm them. There are ongoing trials right now to see trying to lower the threshold maybe to 12 or 14 to see if this vaccine is still effective and safe for this population. But that might take some time. And that's why it's important for the entire adult population that qualifies for the vaccine to get vaccinated as soon as possible, because the benefit will translate to the kids as well.
Right now, people don't really have a choice as far as from what I've heard about which vaccine they're getting. You know, they sign up and then they find out which one is available to them. At any point, do you think that that will change? Will people be able to select which vaccine they prefer once more is readily available and more people have been vaccinated?
I mean, certainly down the road, I think that's plausible. I don't think that time is probably anytime real soon. And I think the message that we want to continue giving to patients is we have really fortunate to have 3 highly effective vaccines at protecting individuals against risk for hospitalization, infection, death, and other severe complications. So the best vaccine is the one that's available to you. It's sounding a little cliche right now, but it really is true. And we really are fortunate to have 3 highly effective vaccines available to us.
All right, great information. Thank you both. We do have to take a quick break, but keep sending those questions to us through our Facebook live stream. We will pass them along to the experts next.
You're watching the CBS 58 News at 7 on WMLW.
If you are just joining us this morning, welcome. We've been doing a live question and answer special this morning called A Shot in the Arm.
We're streaming this newscast on Facebook Live. Join us on Facebook Live right now. There you can submit your questions, whatever questions you have in real time. We'll read them and pass them right along to our panel of medical experts this morning. But first, we get a quick check of our forecast with meteorologist Justin Thompson-Gee.
Hey, good morning, guys. Yeah, we do have some light rain showers out there right now. It's pretty light and scattered activity, but our first day with some precip in about 2 weeks. Most of this activity will continue throughout the morning hours here. Here's 9 a.m. on ReadyCast. A couple more light showers out there by that point. Should wrap up right around noon or just before it. Then most of the afternoon, most of the early evening at least looks pretty dry. Might have a little bit of sunshine. Temperature's pretty warm here for the kids as well to get outside. Then a cold front pushes through later on this evening and tonight, has that into some of our western areas right around 10 p.m. Mainly some moderate rain showers here. Could even have a couple of thunderstorms. Has it into the Milwaukee and Lakeside areas right around 11 p.m. or midnight. Some timing questions on that cold front, so we'll also keep in a rain chance for early tomorrow morning. Otherwise, as we head throughout the rest of your day on Thursday, we should see a nice sunny sky return by Thursday afternoon. And as we go into Friday, more of that sunshine. We are on record watch, though, for 2 records. The first is the warmest low temp. The record for that is 43 degrees. So far, our low, the coldest it's been, is 50. So that record looks to be a lock. We're also watching the record high. The record high today is 68. The forecast is 64. Wouldn't it be something if we break a 130-plus-year-old record today? 64 for that high today with morning and then nighttime showers, maybe some morning showers tomorrow. Cooling down a little bit for the weekend, low 40s there for the start of daylight saving time, and then a chance for rain and snow on Monday.
Justin, thank you. This morning we are continuing our coronavirus vaccine special shot in the arm. We're taking your questions from our Facebook live stream right now.
We have two special guests joining us this morning, and they are Dr. Matt Anderson, Senior Medical Director of Primary Care at UW Health, and Dr. Jorge Ramayo. He practices internal medicine and pediatrics at the 16th Street Community Health Centers. Well, there are currently 3 types of vaccines approved right now in the United States. We've heard a lot about the different effectiveness rates, the efficacy rates between them, 96%, 92%, 66% for Johnson & Johnson, but that doesn't mean exactly what we might think it means. You know, 66 is obviously a lower number than 98 or 96. Doctors, what does that mean?
What the efficacy means is that the 66% is the reduction in risk that somebody who was vaccinated in the Johnson & Johnson trial had as compared to somebody in the placebo group who didn't receive the vaccine. I think when we think about those numbers, it's important to know that they were occurring at different times in different locations. And particularly with J&J, you're talking about happening in South Africa where there are variants and otherwise. The key thing, though, to remember is the data that really was uniform across the 3 trials, which is the reduction in risk for hospitalization, death, and other severe complications. So even in the J&J trial, there were 0 hospitalizations associated with that. So I think, again, people shouldn't probably get too hung up on some of the differences there in the infection percentages because there were differences between the trials, but they should feel really confident in the hospitalization death data that, you know, if somebody does get COVID-19, they're not going to be very likely at all to have those severe complications. And that's really the whole point.
And now we hear some people say, oh, you know, I've heard this from people, numerous people saying, I think I'm going to wait until I can get Johnson & Johnson because it's just one shot and I really like the idea of just having to go once. But that's just really not an option for people right now, correct? Or am I missing something here? And if that is true, why is it important to get whatever vaccine is available to you at this moment?
I feel that people are underestimating the risk of the active choice of not getting vaccinated if you qualify. I've had this happen to some of my staff even, in which they're like, you know, I just want to wait and see what happens or wait until I can get X vaccine. I've had this conversation with patients as well. And my advice universally is just get whatever vaccine you can get your hands on as soon as possible, because every day that you're not vaccinated is another day that you're at risk of contracting the coronavirus and not only getting sick yourself, but also giving it to other people. So that's why I recommend to, at this point, since the supply is limited and you can't really choose and pick which one you may get, to just get whatever it is that is available to you at this time.
Okay, so I want to get vaccinated. Dr. Ramayo, how does it work at the 16th Street Community Health Centers? Which vaccine are you giving out, and how do you do it? Because that seems to be an issue for a lot of people. And because it seems like there's appointments available, but just how do you get them?
Absolutely. So it has been an ongoing effort to make sure that we're reaching out. And we're very fortunate to have a very close relationship with the community that we serve. So what's been happening is a 3-pronged approach. Any patient that thinks they qualify for the vaccine is calling our main call center, and we're usually able to get them in within the week to be able to schedule them for an appointment as long as they qualify. We have our primary care doctors and all the staff that is seeing patients on a regular, just screening all the patients to make sure that they qualify. So if they do, I quickly just go to my computer and make them an appointment on the spot and tell them, I recommend this vaccine, you should get it. And then finally, we have outreach efforts in which we have our social media. We also have our call center calling the patients that qualify, especially our 65 plus, to let them know that they qualify for the vaccine and trying to get them scheduled. So that's how we are doing it. Unfortunately, outside of that community, it's an onus on the patient to do what Dr. Anderson mentioned already, calling the health department, calling your own primary care doctor's office to find out if you qualify and when you can get a vaccine.
Are you finding that most of the appointments that you have available are filling up? Are any of these appointments going unused? And if yes, what happens to the vaccine then?
The appointments are absolutely getting filled up. I've been very glad to see that a lot of the patients, even though there's this ongoing mistrust of the medical system that's historical for a lot of the underrepresented communities, because of that trust that exists within the community and our center, I feel that a lot of the patients have been more willing to accept the vaccine and accept the appointments. And we've been able to ramp up our vaccination efforts. We've been able to use up almost the entire allotment of vaccines that has been given to us with very minimal issues regarding no-shows or issues with us filling out a full day of scheduled vaccinations in the clinic. So that's great news right now.
Dr. Anderson, say I'm eligible right now and I can use UW Health. What do I do? How should I do it?
Yeah, so we continue to really focus on our 65 plus populations who have received invitations from us previously. We have a very large population that needs to be vaccinated, and the demand has outpaced the supply that we've been receiving for sure. So we've been encouraging our patients to look at other options within the community as well, because we want them to get vaccinated as quickly as possible. As far as those groups that became eligible on March 1st, we've had a partnership with local public health in Madison and Dane County, other health systems for our educators, and others within that 1B group. We're going to be hopefully here supply dependent, able to extend more options for invitations and appointments for those individuals coming soon. So more to come.
So we've heard how UW Health does it. We've heard how 16th Street Community Health Center does it, but you could also get it from Walgreens or Pick and Save or the health department, or if you're a teacher, maybe through your school district. So, how do you know what to do? There's just so many options. It's almost overwhelming at times. Can you help people just start?
I will say that it is very challenging, and I think that's some of the concern that we have with the way that the vaccine is being distributed in really a decentralized state. There are pros and cons. The pro is that there are lots of places you can get vaccine. The challenge is that sometimes people, especially people with fewer resources or maybe who are less savvy in understanding the medical system, may have more difficulties. So, we're trying to get the message out through the media and our website, and, DHS has their vaccine finder. I think those are the things, that we can do, although we certainly are a consistent option for people at UW Health within our region and our patients who we're serving. So, it is very challenging. I think it's a very appropriate, concern, but there are a lot of options out there.
All right, doctors, thank you so much for answering these questions. We still have time with them, so be sure to let us know your questions on our Facebook live stream. Up ahead, a new first-of-its-kind vaccination program kicks off this morning. We're talking about that, plus the racial divide with coronavirus vaccinations. The time right now is 7:37 on your Wednesday morning. You're watching CBS 58 Morning News Coronavirus Vaccine Question and Answer Special.
Well, welcome back to our commercial break discussion here on the CBS 58 Facebook Live page. We've got Dr. Anderson and Dr. Ramayo, and we're going to go back to Chuck's question because Chuck asked a whole bunch. We've already answered about the vaccine and the new strains and where they are right now. Here is a question that perhaps you guys can answer, perhaps not. He says, how is it that a counter person in a local business can actually test positive for COVID, need to recover from the illness at home sick, and yet there's no notice to the public that the person was infected, so anyone who did business there would be warned. And that kind of gets to what the business community's role is in informing the public. Can you guys kind of give us your thoughts as medical professionals on that, letting people know that someone that they may have done business with was infected?
I feel that that's such a difficult situation for everybody involved. I think that source control was one of the earlier strategies that we had, especially for the community spread of the virus, for us to be able to prevent the transmission of the virus all throughout. I think that there's a very fine line that the local and state governments have been trying to just walk in terms of like individual freedoms and the ability of people to take personal responsibility, but at the same time, a lot of the personal actions that some people may be taking may be affecting others. So I think that we have to realize that the health department in each city and county has been overwhelmed with the number of cases they've seen and the number of people that might be at really high risk, such as like an outbreak in a factory, for instance, would be really concerning because there's a huge risk of multiple people getting sick in a closed environment. So although I understand the concerns for something like that, in which there might be an outbreak in a specific business, right now the onus is on that business and that center to make it known that they customers might have been exposed, and to make sure that they're getting tested ASAP so they can find out if they're actually affected or not.
I see. All right, Dr. Anderson, Dr. Ramayo, thank you so much. We're going to get back to our live broadcast in just a moment. People watching on Facebook Live, stay with us. We'll be right back.
Health centers now, which take care of the toughest of the toughest neighborhoods in terms of illness.
A federal program to give vaccines straight to community centers kicks off at 8 this morning. It's a program that was touted by President Biden when he visited Milwaukee's 16th Street Community Health Center. It's the only center participating in the state, and they plan to vaccinate 2,000 people through that program every single week. We have Dr. Jorge Ramayo from 16th Street Community Health Centers. He is one of our experts joining us this morning, along with Dr. Matt Anderson from UW Health. Dr. Ramayo, what sets this clinic apart? What sets your clinic apart from other COVID vaccination sites?
I feel that we have this just close commitment and just communication with our patients in our community. We are located in the center of this community. We've been serving this community for many, many years. We have earned their trust. And when we during the COVID vaccine, we've been able to innovate so that way we can get telehealth appointments ASAP. We can get them be seen for acute respiratory issues, even though COVID was rampant, by innovating, creating outside tents to be able to see them actually. So we've done a lot of work to be able to serve the needs of the communities that come up. And we have all the other ancillary services that they need to address issues like housing or other psychosocial components of their care that is so prevalent in underserved communities. So I think that the community centers, such as 16th Street, are perfectly situated to be able to reach these really hard to get communities that may not be as technologically savvy to be able to go to multiple websites to find a vaccine appointment. As long as that availability is close to the people that need it, that's when we'll be able to actually get those at highest risk vaccinated.
You talked about the work you've been doing to build that trust. How built back up is it? Because the numbers are still pretty low in a lot of minority communities.
Yes, no, I think that there's a lot of, the trust is there, but I feel that there's been a disengagement with the medical system since COVID started, mainly because a lot of people were too scared to come to the doctor. We've been seeing that a lot of our diabetics and people with high blood pressure have not seen a doctor for over a year. So we're inviting people to start coming back, especially now that our numbers are low enough to be able to start seeing more and more people in person. But I feel that the disengagement with the medical system has been one of the biggest issues. Despite that, whenever we're able to get in contact with patients and tell them about the vaccine and the opportunity to get it, a lot of them are more than happy to jump at the opportunity.
And, you know, when it comes to hesitancy initially among minority communities, what are you guys doing at your clinic to actively try to break down those barriers and encourage people to come in and get those shots?
I can speak on the UW Health side that we've been very proactive in trying to, promote an equitable vaccine distribution, and hesitancy is part of that. So one thing that was really key for us was we prioritized our people of color and our 65 plus and through other mechanisms with our employees, because we want people who want the vaccines in those communities to be able to go back, like we were talking about earlier, and tell other people in their community about how they were vaccinated, how they feel about that, the protection, and what their experience was. We're partnering actually with local nonprofit groups now to have vaccine patient educators who are people in the community who are respected and trusted, and we're really trying to partner alongside of them so that they have the ability to reach out to our patients, who we know are at increased risk, and are having those conversations and then able to schedule into our vaccine clinics to get them to take an action at that point after their questions have been answered.
Let's go to our Facebook questions right now. Chuck and Tim both asked similar questions with similar suppositions for the future. Let's take Tim. He said, asking, should people who haven't got the vaccine and are not even remotely in a middle risk age health group just wait until next year's new vaccine? And Chuck asked something about new vaccines for variants. And I think the supposition they're making is that we're going to have to keep doing this every year like the flu shot. Is that what you guys are supposing right now?
So I do not know. I don't think anybody knows whether this is going to be something that's going to require a booster or something like the flu shot. But I would warn against just chucking it off and deciding not to get vaccinated. My recommendation stands. if you qualify, you should get the vaccine as soon as you do, regardless of whether it's now or a month from now or 2 months from now. I feel that just waiting to see what else will come around the corner is not a good strategy, because you're still at risk of contracting COVID and having complications. So as soon as you qualify, you should just get the vaccine that's available to you.
Well, we have to take a quick break now, but keep sending in those questions over our Facebook live stream. They've been wonderful. We'll ask some more when we come back.
All right, welcome back. Thanks so much, doctors, for joining us this morning to answer some really great questions about the coronavirus vaccine. My first question to you, as we're in break here, for those who are on the live stream with us, is if someone is pregnant, is it safe to get the vaccine?
The American College of Obstetrics and Gynecology has some great resources out there, and I think that the good news has been, although the trials didn't enroll pregnant patients, there were women who became pregnant during that, and I think that we're seeing from our OBGYN group and family medicine and those who are treating those pregnant women. I think there are a lot of good conversations, and I think there's a lot of evidence that they likely are safe, and that many women are choosing to be vaccinated and doing just fine with it, and their children as well. So I think that it's a good conversation to have with their provider, but there's also a lot of reason for optimism that we're seeing things go the way that we would like them to in that population right now.
I would also like to add to that being pregnant makes you a high-risk patient, and we have seen in the data that there is a very high risk of complications, both to mom and baby, if you have COVID during pregnancy. So you have to really weigh the risk and benefits of, getting vaccinated. It seems safe, but we do know that the risks of getting infected with COVID while you're pregnant are quite high.
Dr. Ramayo, let me ask you about undocumented Wisconsinites. Should they feel safe to go in and get a vaccine without any fear of repercussions?
100%. I would like to let them know that this is a public health effort. So undocumented or anybody that's a citizen, at the end of the day, we're all living in a shared space, in a shared city. So if anybody gets sick, they're human and they can transmit this to other people. So it is not a matter of what's fair or who actually deserves this, whether based on their, whether they're documented or not. I feel that it is about getting as many people vaccinated as possible to lower the risk of the entire population.
All right, Dr. Ramayo, Dr. Anderson, thanks. We'll have more questions when we come back in just a moment. Welcome back to our coronavirus vaccine special, Shot in the Arm. This morning we're taking your questions from our Facebook live stream and getting you answers directly.
We are talking with Dr. Matt Anderson and Dr. Jorge Ramayo, and we want to get those questions answered right away. We have a viewer who wrote into us. She says, I was out of quarantine on 1/26/21 from having been tested on 1/13/21. When can I get that vaccine? Do I have to wait 90 days?
If that individual was positive for COVID-19, we certainly would want them to be fully recovered from that and, out of that quarantine period, which it sounds like they would be. The thing to know is that after natural infection, that immunity, we think, lasts for about 90 days. So there's not necessarily a reason that somebody can't get the vaccination in that 90-day period. They could have more side effects, however, the closer they are to their original infection. So I would say it generally is somewhere in that 90-day time frame, but they may have lower risk of side effects while still benefiting from the natural immunity of the infection the later in that 90-day time frame they get vaccinated.
Another person asks, can I still test positive if I had COVID-19 in the past? They don't say how long in the past, but from what we know right now, can you get it twice?
I can speak from personal experience that I've had several patients that maybe had the virus back in March. They had a negative test in June, and then in December they tested positive again. So I have had a handful of patients that did get reinfected with COVID. So that's another one of the risks that I've been warning people about. And there are documented cases in the literature of COVID reinfection. So the answer, in my opinion, is yes.
Let's talk about the timeline when it comes to kids getting the vaccine. What are your thoughts? What have you heard as far as when we could expect our school-age children to start getting that vaccine?
I think like Jorge said earlier, some of those school age, maybe the older school age children, the trials are going on right now. And I think, rough timelines, hoping for around the fall, late summer, seeing how those trials go and what comes out of that. I think then you're going to also see maybe a little bit after that for the younger children depending on how those trials go as well. But right now, I think that's the general thought on the time frame.
All right, thank you both. We do have to take a quick break, but please keep sending in those questions on our Facebook live stream. We will pass them along to the experts.
Welcome back here on the Facebook live stream. And one question that I wanted to ask is for people who are not currently eligible, maybe they're young, they're in good health, but they do want to get the vaccine. Tell me about how the extras work at your places. Can you wait in line and hope for one that was left over so it doesn't go to waste? How does it work at your place? Dr. Aramayo, why don't you start?
Sure. We tend to have a waiting list of people that are really interested in the vaccine. So we tend to just make sure that we have the number stockpiled towards the end of the week. And then if we have somebody, we have a calling list. But we don't have, we're trying to prevent too many people being physically present in one place at one time. So we do not have a waiting area for people that are just kind of like standing by to see if somebody will not show up for their appointment. But we do have a waiting list of people that we usually call at least a few hours or a day ahead to let them know.
Dr. Anderson?
Yeah, and I can share, we have a list of people who are currently eligible, who maybe are scheduled several weeks out and want to move up. So we would recommend people not come and wait around for an extra dose, because we actually have a separate process for that. So people would not be successful in getting their dose from us that way.
Okay. We've called and talked to different Walgreens pharmacists, and all seem to have different rules. Some will say call that day, maybe you'll get it. If you're not eligible, you'll never get it. There seems to be different everywhere. So I guess you just got to kind of call around.
Yeah, thanks.
All right, thank you both. We'll be right back with you in just a few minutes. And we are nearing the end of our coronavirus vaccine question and answer special.
Yeah, we're working to get everyone's questions answered this morning. Dr. Matt Anderson from UW Health and Dr. Jorge Ramayo from 16th Street Community Health Centers. So let's get to another question. Maggie, you said we have one more from the viewer?
We do have one. This is from Leona, and she says, do I count the 90 days to get the vaccine from the date I tested positive or the day the doctor took me off quarantine? This is so confusing.
Yeah, it's the day that you test positive. So I think that's when the 90-day time frame would really start. So I would go with that one.
All right.
Okay.
Doctors, we have just about 2 minutes here, maybe a little bit less. So I'm going to ask for a final thought from both of you. Dr. Ramayo, why don't you start first and tell us what you want your people to know right now?
Absolutely. I just want to reemphasize that the vaccine is safe. We've had enough evidence to see that the safety is there, but also to see that it prevents hospitalizations, it prevents deaths. And I've been telling everybody that you really need to think long and hard about choosing not to take the vaccine versus taking it, because choosing not to take it or to wait around is an active decision. If you're not doing it for yourself, do it for your family, for your community, or even think about the people that would have given anything to be able to be vaccinated that we have lost to COVID. So please consider getting vaccinated as soon as you're eligible.
Dr. Anderson? About 30 seconds.
I want to echo that. The vaccines that we have are highly effective. They are safe. The best vaccine that you can take is the one that's available to you. So please, to everybody who's eligible, avail yourselves of the opportunities. For those who aren't eligible, appreciate everybody being patient. We want to get that shot in your arm as much as you want that shot in your arm. So we're going to do everything we possibly can to make that happen. But while we're doing that in public spaces, please continue to mask, socially distance, and show those respect for other people while we're still trying to get more people vaccinated. We all want to get to a pre-COVID state. The best way to do that is to mask up, distance, and get your vaccine when you can.
All right. Thank you both for joining us this morning, and thank you to everyone for watching.